That's a problem. A new Yale study indicates that women suffering from heart attack symptoms are less likely to have it diagnosed properly, leading to serious problems. Heart attacks occur when blood flow to the heart is cut off, often due to arterial blockage, which then results in tissue death or damage. In the U.S., heart disease is the leading cause of death for women, accounting for 1 in every 4 female deaths. Data from heart attack patients aged 18 to 55 show that 53% of women who sought help prior to hospitalization were told their symptoms weren't heart-related, compared to only 37% of men. 90% of men and women reported having chest pains, but women often had extra symptoms like indigestion, heart palpitations, and pain in the jaw, neck, and arms. Instead of attributing their symptoms to muscle pain, the women were more likely to chalk it up to stress and anxiety. They also had multiple risk factors for heart disease, which suggests doctors should do more to rule out a heart attack when presented with such cases. Heart trouble?
Boy's heart stops after eating a hot dog. A boy who ate a heart-stopping hot dog is the subject of a strikingly odd new medical study. A report in the medical journal Pediatric describes how a 9-year-old boy's heart stopped beating after he began eating a hot dog in Istanbul, Turkey. He was later resuscitated. Choking can lead to cardiac arrest in children, but in this case, medical staff found the hot dog stimulated the boy's vagus nerve, which in turn triggered an abnormal rhythm that caused his heart to stop. Upon further investigation and an electrocardiogram, he was found to have a rare life-threatening heart rhythm condition known as Brugada syndrome. The child was later implanted with a defibrillator to help regulate the abnormal heart rhythms via electrical impulses. The condition is reportedly inherited and more common among those of Southeast Asian descent. Can you have a heart attack without realizing it? Spoiler, yes you can. Heart attacks may not always be defined by crushing chest pains and can sometimes strike with few to no symptoms. A heart attack, or a myocardial infarction, occurs when a clot blocks the flow of blood and oxygen to the heart, which damages or kills heart muscle cells. The most common symptom of this is pain or discomfort in the chest area. But research has found that at least 45% of attacks are silent, occurring with less intense symptoms and thus go undetected. Silent myocardial infarctions have been known to take place in men more than women. Symptoms are often mistaken for other conditions and include fatigue, dizziness, nausea, and pain in the neck, jaw, and arm. Silent heart attacks are usually identified using an electro or echocardiogram, which detects damaged heart tissue. Patients who have suffered a silent attack are at a higher risk of having a second one or succumbing to sudden cardiac arrest. Doctors stress the importance of getting checked, even if the symptoms may not seem serious. At the end of the day, it's better to be safe than sorry. Tetralogy of Fallot explained. Late-night talk show host Jimmy Kimmel became visually emotional during his show on Monday after revealing his newborn son was diagnosed with a congenital heart disorder and had to undergo emergency open-heart surgery. His son, Billy, was born with Tetralogy of Fallot, which occurs in only 5 of every 10,000 births. But what exactly is this condition? In a healthy heart, oxygen-poor blood flows into the right atrium and ventricle, through the pulmonary artery, and into the lungs to be oxygenated. The now oxygen-rich blood flows back into the left atrium and ventricle and is pumped out through the aorta to be circulated into the body. Tetralogy of Fallot is when a heart has a hole in the interior wall separating the ventricles and a narrower pulmonary passageway. This means the heart works harder to pump blood into the lungs, resulting in thicker right ventricle muscles. Because of the hole in between the ventricles, oxygen-poor blood is allowed to flow directly into the aorta and the rest of the body. This lack of oxygen causes a bluish tint in the skin, lips, and nails. The exact causes of Tetralogy of Fallot remain unknown, and treatment requires surgery. Left untreated, patients are at an increased risk of sudden death, especially in the first 3 years of life. Many children who have it survive into adulthood, but need lifelong medical care to keep them healthy. Meanwhile, debates over U.S. healthcare have dominated this week's headlines, as the American Health Care Act has just passed the House of Representatives. And with Trump Care, there's a chance people with pre-existing conditions, such as Tetralogy of Fallot, will be denied coverage.
Hospitalized by heartbreak. Tragedy really can break your heart. Texas woman Joni Simpson found that out the hard way after the death of her wee dog, Miha. The emotional toll of Miha's death left Joni hospitalized with a broken heart, but how does that work? Also known as Takotsubo cardiomyopathy, broken heart syndrome sees severe weakening of the heart's left ventricle after a stressful event. This pot-like shape is where the condition's name comes from. A takotsubo is a Japanese pot used to trap octopuses. Experts believe the sheer amount of adrenaline and hormones triggered by the stressful event may temporarily stupefy the heart. Symptoms involve a shortness of breath and chest pain. Several tests are required to identify the condition, as electrocardiogram readings of it are usually identical to a heart attack. Most doctors prescribe heart failure drugs to help. The condition affects vastly more women than men, and around 1 in 5 of those suffering the condition die from it. Joni, the woman we mentioned at the beginning, eventually recovered from her heartbreak after a year of treatment.